At Florida Polytechnic University, a team of computer science students is working to improve the way Lakeland Regional Health Medical Center monitors critical surgical equipment. Their actions will help keep costs down while making surgery safer. PGTV visited Florida Poly to learn more.
So this is a senior design project given to us by Lakeland Regional Health, and we are trying to solve the problem of equipment being left inside of patients. And that's a national problem, not just locally, but it's a real problem. And so our goal is to develop a software that can detect when objects have not returned to the places in the hospital they're supposed to return to after a hospital visit, which will tell the staff that that object may have been left inside of a patient. We met with the head of the OR at Lakeland Regional Health and talked about possible solutions, what we could do to solve this problem. We talked about the possibility of implementing sensors in the tools, microchips, things of that nature, but most of them would either add extra costs to the hospital or interfere with day-to-day operations. And so what we came down to was a computer vision and machine learning based approach where an actual camera system will scan the trays as they return to the serial processing unit and visually detect what objects are there without interfering with day-to-day operations.
So the onboarding process is about the same as if you're applying to Lakeland Regional. So you have to fill out a bunch of paperwork, pretty much things like, how was it? You have to take a drug test, you have to sign your rights pretty much to them so that you can't really sue them for things like that. You have to sign moral codes, because obviously drugs and all that jazz in the hospital. And when you go to work on a project like this, you kind of need to see the premise, you have to be part of it and such. So access to the hospital is pretty important. And for that, you just have to sign a lot of paperwork.
So I'm the newest member of this team. Due to scheduling conflicts, I got to choose which team I wanted to join for the next semester. And I think there was only one obvious choice, which was this team. I managed to see their presentation at the end of the semester, and getting to see how much hands-on they were working with the hospital and just how far they'd worked on the project and just how much of a complete product they already had made me extremely interested in the project. Unlike a lot of the other all the other projects, this one is much more industry involved. So this is a product that I can actually see being used in the industry, which is why I decided to choose this one. And while we have completed a lot of work already, in the first semester, getting all the back-end code to work, being able to actually see our code is able to detect what objects are on the tray and being able to respond that to user. But for the current semester, we plan on making it into a much more user-friendly sort of environment.
The benefit of the system is that it can cut down on around $22 million a year of incidents resulting in or resulted from objects being left in patients. And so not only is that good monetarily for the hospitals, but that means that we have around 110 people every year who hopefully don't have to deal with objects being left in them when they have surgery, which is a horrible thing to have to go through. And so the system should be able to detect that that may have happened before they even leave that area of the hospital, and doctors can fix the issue before it's actually a problem.